My grandfather and great-grandfather started Junction Auto in 1931.
If you want to pay more, that's your business. If you want to pay less, that's my business.
Please tell me how you discovered this tumor mass on her gums.
She was crying one night, which opened her mouth a little bit more, and I seen like a little piece of tissue, it looked like, and calmed her down and looked at it, and I thought it was an abscessed tooth or something.
How long was the surgery?
Originally the biopsy was 3 or 4 hours, and then she had a 13-hour procedure later on to excise the tumor and reconstruct. They removed the entire left side of her upper jawbone, all of the baby and adult teeth, her cheekbone, and part of the nasal cavity on the left side, and part of the orbit of the eye.
The left half of the roof of the mouth.
That's it.
Okay.
And then they took a graft from her knee to her hip of soft tissue and reconstructed. They put in a trach to help her breathe through healing, and inserted a G-tube or a feeding tube into her stomach through a port.
You are a surgeon's assistant.
Yes.
You work at Chardon Medical Center. Mm-hmm. You've seen lots of surgery. How does this make you feel, knowing that this happened to your own child?
It's devastating. You know what they're doing in there, which makes it so much harder to know exactly what's going on behind those doors. It definitely makes me closer to my patients now when I do work. But there's not really words to describe how I felt that day.
How about you, Mike?
Well, like you said, it was devastating. It's almost like it isn't real. Like, you never think, you see people that have cancer and you know it's out there, but you never really think, especially as healthy as she was, that it's going to affect you directly until it actually does. And even at times when I've been talking to people, I'll stop and I can't believe I'm actually talking about cancer, about my daughter. It's almost unreal.